want to thank everyone for coming out here for lunch to talk about sleep disorders. I'm Mark Hendricks. I'm in practice in Macon. Have a pulmonary critical care sleep practice, which I definitely enjoy sleep and try to put more of my interest into the sleep part of my practice. I do come to Dublin here right now once a month, seeing sleep consults and patients, and hope to expand that time here. But what we're going to talk about today is sleep disorders, and this is very informal. If you have a question, just raise your hand, interrupt me, and we'll just go through those questions through the program, okay? So we're going to be talking about sleep disordered breathing, identifying patients with sleep apnea, talk about the methods of treatment, sleep apnea and its comorbidities, the results of treatment, and occupational health and sleep apnea. So sleep disordered breathing describes a number of nocturnal breathing disorders. Mostly what we see is obstructive sleep apnea, which we'll talk about more. Less commonly, we see central sleep apnea, nocturnal hypoventilation, and something called Cheyne-Stokes respirations, which we see a lot with some of our cardiac patients. The prevalence of sleep disordered breathing and sleep apnea, approximately 42 million American adults have sleep disordered breathing. That's 1 in 5 have mild sleep apnea, and 1 in 15 has moderate to severe sleep apnea. 9% of women, 25% of men in the middle-aged working population have sleep apnea. Sleep apnea is defined by what we call an AHI, and that stands for apnea-hypopnea index. And that's basically the events per hour that someone stops breathing or has shallow breathing during the nighttime. So when you talk to your physician about your sleep study and the severity of your sleep apnea, we'll be talking about the AHI on the severity. And approximately 75% of severe sleep apnea patients are not diagnosed. Okay? So definitions: apnea. Apnea means stopping breathing, basically. And we define that on a sleep test by stopping cessation of airflow for at least 10 seconds. It can be obstructed, central, or mixed. A hypopnea is kind of a shallow breath during the nighttime, and it's defined as a decrease in airflow of at least 10 seconds with a 30% reduction in the airflow. It's not a complete stopping of breathing, but it's a shallow breath. And as a result of that, your oxygen level is dropping with that event. And there's flow limitation, usually due to upper airway narrowing. So obstructive sleep apnea is the most common form of sleep disordered breathing. Partial or complete collapse of the upper airway. So the muscles that help control and support the soft palate and the tongue, they relax at nighttime when you're sleeping and basically block airflow. So we always do a throat evaluation as part of the evaluation for a sleep disorder patient. And commonly, especially with children that sleep apnea, they have very large tonsils. And usually taking the tonsils out of a child will cure them of their sleep apnea. Less commonly, adults have a problem with large tonsils, but occasionally we do see it. The elongated structure in the mid portion of the back of the throat is called the uvula. Sometimes that can be really long and enlarged and can cause some of the obstruction to your airway at nighttime. And sometimes the tongue is very large, okay, and it can get relaxed at nighttime when they're sleeping, roll back to the back part of the throat, and block the airflow, okay. So increased risk factors for sleep apnea. Obesity is a big concern, and we define obesity with a body mass index greater than 30. More prevalent in males. Family history, hypertension, large necks, alcohol. It has a relaxing effect on the airway and can lead to more of the obstructive process. People with upper airway, facial abnormalities, small jaw that puts the position of the tongue more toward the back of the throat, children born with Down syndrome, with facial abnormalities, smoking is a risk factor. Also, endocrine metabolic disorders, as we'll talk about. So the signs and symptoms of sleep apnea. Oftentimes the patient's spouse brings the patient to our attention with the history of snoring. So loud snoring is certainly a strong indicator. People being very sleepy and tired in the daytime. The bed partner noticing the patient stopping breathing during the nighttime or gasping, choking, coughing during the nighttime. Depression is associated with it. Oftentimes morning headaches are classic for severe sleep apnea. Hypertension, frequent urination during the nighttime we see. And a big indicator is atrial fibrillation. We see a lot of sleep apnea patients that have an existing diagnosis of atrial fibrillation. So again, the classification of sleep apnea, we classify this by the AHI, the apnea-hypopnea index. And this reflects the severity of sleep apnea. Generally less than 5 is considered normal. 5 to 15 events per hour is considered mild, 15 to 30 more moderate, and greater than 30 is considered very severe. So how do we identify these patients with sleep apnea? Well, usually as part of the workup in our office, we have the patients fill out a scale called the Epworth Sleepiness Scale, and that's a series of questions that you rate based on your chances of falling asleep in certain situations. And that just gives us a degree of how sleepy the patient is. Usually greater than 10 points is considered increased sleepiness. So just a cartoon here, you may have had some experiences having a sleep study, and it's not a nightmare as this cartoon tries to describe, but there are some wires involved and video equipment, etc. But typically, it's, spending the night in a sleep lab should be a good experience. It's generally like a hotel room, decorated like a hotel room. It's a television there, nice comfortable bed, bathroom, etc. We do put monitoring equipment over your nose and mouth, EKG leads so we can monitor your heart rate and rhythm. There's leads on your legs that we monitor for leg movements. Okay, so the patient is getting some diagnostic equipment set up on them. And in some cases, we can do home sleep tests, which are not, certainly our in-lab tests are a lot more helpful to us reading the studies. We get a lot more information. However, home sleep tests do have the availability to diagnose a patient with sleep apnea. So how do we treat sleep apnea? And positive airway pressure, or CPAP, CPAP stands for continuous positive airway pressure, is generally considered the gold standard for treatment of sleep apnea. And how that works is it's just a small compressor device with tubing to a mask, and Dr. Daly and his daughter have got a CPAP machine and some mask over there that we can look over after this. And it delivers a pressure of air, okay? And that pressure of air basically helps create a splint to the airway, a pneumatic splint, to prevent that collapse in the back part of your throat, okay? It's very effective, it's very safe, and that's generally the first way we go as far as treatment. There are some alternatives. Surgery is usually, we consider that certainly in children that have very large tonsils. That's the first choice of therapy in children in most cases. However, in adults, it's generally less effective But if the patient is just adamant about not being able to comply with CPAP and they may be a big candidate, we can consider that. People that have more mild to moderate obstructive sleep apnea that fit the right criteria can be fitted with a mouthpiece. And the mouthpiece that the patient wears, how that works is it kind of brings the angle of the jaw more forward, which brings the tongue more forward out of the way of the back of the throat. Okay? So people that definitely have some of those upper airway abnormalities, not largely obese, can be treated in that way. Drug therapies is really not a drug to treat sleep apnea. However, sometimes patients, even though we treat their sleep apnea with CPAP, they may remain still very sleepy during the daytime and a hard time functioning with their job, etc. And in those cases, sometimes we do add some stimulant therapy to help them stay awake. Tracheostomy, that's kind of at the last ditch option that we use for treatment. Certainly patients that are very severe that are not being able to tolerate any other form of therapy, that would be considered kind of as a last option, but very, it's very effective. Pacing, that's not really being used more in more research areas at this point.
Portions of this program are brought to you in part by Fairview Park Hospital, a leader in healthcare for Dublin, Lawrence, and surrounding communities, providing community healthcare services including 24-hour emergency room.
So as we talked about, CPAP treats sleep apnea by creating a pneumatic splint to keep the upper airway open. Other options, the Inspire therapy is a new type of therapy that's kind of come about over the past year and a half or so. You may have heard about it on the radio, television, etc. But it's basically hypoglossal nerve stimulation. The ear, nose, and throat doctors do this procedure. And in the properly selected candidate for this therapy, it has shown to be effective. And how it works is the ear, nose, and throat doctor puts a generator device under the skin, kind of like a pacemaker, with wires that go to the tongue. And they innervate the tongue nerve there, the hypoglossal nerve. And at nighttime, when the patient's ready to go to bed, they have a remote device that they wave over the generator to turn it on and activate it. How it works is it innervates that nerve that kind of pushes the tongue more forward or anteriorly to prevent that collapse. Okay? But again, it takes a properly selected patient for this, generally not a non-obese patient. And certainly we like to have had these patients have tried CPAP first and have failed CPAP therapy before we consider this. Okay? That's just a picture of an oral appliance that's used, how they work, and they're adjustable so that you can slowly advance the lower jaw forward to get the tongue more forward out of the way. Problems with these mouthpieces, people that have TMJ disorders, a lot of chronic pain in the jaw, that can certainly make that worse. People that have poor dentition, edentulous without teeth, are generally not candidates for this because it has to create a suction to the teeth for it to remain in place. Okay. So again, CPAP therapy, we have a lot of different types of masks that we can use, and we're going to show these to you that are very comfortable, and the machine is very quiet. And talking about the comorbidities with obstructive sleep apnea, which, as you can see, hypertension is at the top. Drug-resistant hypertension, those people that are on several medications for their blood pressure and still remains out of control. It has shown that treating the sleep apnea can help reduce your blood pressure to some degree, at least the top number by 5 to 10 points. Obesity is such a huge problem. congestive heart failure, people with pacemakers, atrial fibrillation, all the heart conditions, we see a link between those and sleep apnea so commonly. Diabetes mellitus. So guidelines featuring sleep apnea, they talk about drug resistance hypertension, the stroke risk with sleep apnea, and how important it is to try to get these people diagnosed and treated for their sleep apnea. Diabetes, certainly sleep apnea is typically associated with conditions of metabolic syndrome that we see with hypertension, obesity, and diabetes. 48% of patients with type 2 diabetes have sleep apnea. 86% of those with obese type 2 patients have sleep apnea. So there is an increasing severity of sleep apnea that is associated with poor glucose control, independent of the level of obesity. And it has shown that sleep apnea is an independent contributing factor to insulin resistance. Okay? So new studies have shown that CPAP may improve glucose control and insulin sensitivity. And CPAP can also reduce some of the cardiovascular risk factors in these patients. So healthcare providers should be aware of the clinical connections between type 2 diabetes and sleep apnea. So a lot of this is just going over things we've already talked about, but the key is the link between hypertension, cardiovascular disease, the risk of stroke, all these factors are linked to sleep apnea. Okay? Obesity is such a big problem. Those that have a BMI 30 to 35, 40% of those patients have sleep apnea. So it's also important why to treat sleep apnea before any surgery. Okay, and a lot of you may have had an endoscopy procedure, colonoscopy, had sedation, and afterwards could potentially have some problems with your respiratory status, and the anesthesiologist may have told you, you need to get evaluated for sleep apnea. That's commonly where we see this. However, it has been shown that sleep apnea and hypertension are the leading independent predictors of complications in bariatric surgery as well as other surgeries. So treating these patients with CPAP before their surgery can decrease the complication rate and the impact of the comorbidities. So again, there has been some results showing that CPAP therapy can help improve some diabetic control, insulin sensitivity, improvement in blood pressure, also with heart failure patients, helping improve some of their cardiovascular disease. Okay. So just to touch on this, certainly drivers with sleep apnea are more dangerous and more costly. 28% of truck drivers have sleep apnea, which is pretty scary being on the interstate going down I-16. 6 times the increased risk of crash. It has been described that sleep apnea drivers can be more dangerous than drunk drivers. Okay. Certainly associated with increased cost and hospitalization rates. So I'm going to end here.
Hey, it's my pleasure to share with you some aspects of the treatment of obstructive sleep apnea syndrome using a CPAP machine. We're very fortunate in this field of medicine to have 100% effective treatment. The CPAP machine is indeed 100% effective when the patient uses it. The machine's set up like this. It's a self-contained unit. All it does is generate air pressure. This air pressure is very light. It's about the same amount of pressure as if you took a straw and blew in a cup of Coke. Very light pressure. We have a humidifier here that's used to moisten the air as it travels down this small tube to a small mask. And most of our patients now use these little mini masks that fit underneath the nose and seal using these prongs or, an alternative, we'll seal using this little saddle here. And so we have a very small mask profile that makes it comfortable. It doesn't leave marks on the face, and it applies the pressure to the throat and enables the throat to stay open and unobstructed during sleep. So the treatment here is very effective. It relieves the sleep apnea, relieves the snoring. We've nicknamed the machine the wife's best friend, and that's indeed what it is. When I get the mask seated, you can't hear this machine run. You can't hear the air moving through it. And that's how it works with the patient at night. Once it's sealed and at its proper operating pressure, the machine is virtually noise-free. In fact, the bedroom would be noise-free because we get rid of that awful snoring. The machine also has parameters that the patient can set, and then once a day, this particular model will dial to an internet site and report how that patient breathed on that system, how that mask fit during the night, calls every day and reports that data, so that enables the physician to have a much better idea of the ongoing progress and success of the patient, and enables us also to intervene more early if we see signs of problems. Very successful setup, very well thought through, easy to use. So folks who go on CPAP, you know, the thing that really warms the heart of a physician is to have them come back and they'll tell you, Doc, I've never felt this good in my life. For something that's so simple, no medication, no surgery, just simple mechanical effect of this air pressure, to have such a remarkable change in a person's quality of life, their health, and their functional capacity. It's remarkable what patients tell us about the improvements they see with the regular use of their CPAP machine. That's why they stay on it. If there was no improvement, why would a patient use this every night? But yet, thousands, and in fact millions of people use this across the country and across the world. It's the standard of treatment internationally for obstructive sleep apnea syndrome. If you'd like to get more information about obstructive sleep apnea syndrome or other sleep disorders in the Dublin area, please call Fairview Park Hospital. They have a patient helpline and they can get you set up to be evaluated.